What is up, guys? My name is Blessing Kumbu. Hope you are all keeping well. I would love to take this moment and thank everyone that has been following the Road to Medicine series up until the very last episode. It has been nice getting to interview speakers, getting to share knowledge with you guys on how to transfer into medicine, giving you tips and sharing their journeys. I hope that you guys are motivated and you loved the videos and the project managed to help you guys. So in this very last episode, I'm not going to be interviewing anyone, but what I did, I interviewed doctors from different specialities, and we recorded short videos of them just giving you general advice as aspiring medical students. So I hope that you enjoy the compilation of the short videos and that now you are motivated to get those applications going, because remember, if you work hard for it and you really, really want it, nothing can stop you. Stay tuned and stay blessed. Also, don't forget to subscribe to my YouTube channel and keep sharing those links.
Hi, I'm Dr. Efosa Hamba. I'm one of the neurosurgery registrars at Groote Schuur UCT. My advice to anyone who's aspiring to be a doctor, medical student, is to enjoy the journey. People always focus on the destination, getting to med school, finishing med school, becoming a doctor, getting a registrar, but also just take time to enjoy the journey and the process of getting there. I think sometimes we forget that and we lose out on a lot.
Good morning, everyone. My name is Jesse Bulabula, and I'm a neurosurgical registrar here at Groote Schuur Hospital, Department of Neurosurgery. An advice for you guys in medical school or aspiring doctors is that it is a long road. It is very hard, but it's definitely worth it. You're going to be tested mentally, physically, but you'll definitely grow as a person. And medical is something that's always been romanticized, but as you get into it and you experience it more and more, you realize it's more about you loving wanting to be a doctor, but more so about the lives you actually get to change. As cliche as it does sound, actually does still actually drive the main motivation of actually being a doctor.
Hi, my name is Dr. Apia Baden. I'm one of the newly qualified neurosurgeons in the department here at Groote Schuur. My advice to aspiring medical students would be, for sure, you have to find yourself a mentor. What I've found is that it's always good to identify someone ahead of you, someone who is successful, someone who is succeeding, and someone you admire, someone you aspire to be like, a role model of sorts. So I think once you find someone like that, a very good role model who is in the exact position you're trying to get into, the probability they've gone through all the challenges and all the challenges that you are bound to experience. So I think once you discuss with someone like that, you are more likely to succeed going forward. Over and above the specific research you do about entry requirements into courses, different universities that you need to get into, or different universities offering the courses. Find yourself a mentor, be the best decision you'll ever make.
Hi, my name is Dirk Blom. I'm an internal medicine specialist with a special interest in lipid disorders. I work at the lipid clinic of Groote Schuur Hospital. What is my advice for anyone wanting to study medicine? Don't be discouraged. It is a hard degree to study. There's lots of work. You may not like every part of it, but once you've completed your degree, then medicine offers unending possibilities. So if you want to be a clinician researcher, if you want to be a family practitioner, if you want to be a radiologist, if you don't want to see patients again, you can become a pathologist. You can even become a politician in medicine. So medicine has something for everybody. You will really find your niche. So persistence, and it'll work out. Thanks.
My name is Pumla Singati. I'm an associate professor and head of division of clinical pharmacology. So as clinical pharmacology, we worry about giving the right drug to the right patient at the right time for the right duration the first time around, essentially we want to minimize side effects while we are optimizing the efficacy of the medicine. So what I would advise someone who wants to switch to medicine is that wherever you are, you must try and do your best. So if you are getting straight A's in the field that you're not liking at the moment, if I can call it that, you must still want to excel, because there is a stiff competition about people wanting to do medicine. You will be competing in each year with people that got straight A's from matric for acceptance. So you need to do your best wherever you are at that point. And it's also important to try and apply as broadly as possible. Do not just apply to the university where you are at. If you want to do medicine, you have to apply to all the universities in South Africa.
Hi everybody, my name is Mashiko Sitedi. I'm currently the head of Division of Medical Gastroenterology and the incoming head of medicine at UCT, University of Cape Town, Groote Schuur Hospital. What I do want to say about medicine and the journey is that it is a very, very long journey. And with the rapid developments and advances in medicine, it really makes it an exciting and fast-paced career. But having said that, it really and truly is the most fulfilling career. I think there are very few things that will give you the satisfaction and fulfillment of rendering a sick patient to complete health. And so my advice for you would be, if you want to enroll for medicine, do it for the right reasons. If you want to touch people's lives and change patients' lives and do so tangibly, then medicine is a career for you. I wish you well as you consider this very important career decision as to whether you should do medicine or not. Thank you.
Hi, so I'm Sitombo Matungo. I'm an orthopedic surgeon at the University of Cape Town and Groote Schuur Hospital, and my subspecialty is orthopedic trauma specifically. So you think you want to go into medicine? It's a wonderful idea, and we definitely welcome more and more young people. So I'm excited that you are interested in doing medicine. So what advice can I give you? Firstly, you gotta want to do it, because it's not, the hours are long, and you gotta be prepared to work in a big team. You gotta be prepared to work under pressure, and you gotta be able to handle sick patients. You gotta be able to not faint when you see blood. You gotta be prepared to see, people that are bleeding, babies that are terribly unwell, so you gotta be able to deal with the possible stress of working in a high pressure environment. You gotta be able to deal with emergencies and stay calm during emergencies. And apart from that, it's a great specialty. I'm absolutely enjoying it, and I hope to host you or welcome you into our team one day. Good luck.
I am Salome Masume. I'm a professor and the head of global surgery at the University of Cape Town. I'm also an obstetrician and gynecologist. And so I find medicine to be a very exciting and fulfilling career. And you are able to impact not only individuals, but families and communities. And so in the work that I've done, it's been really exciting in being able to deliver unborn babies and seeing families light up, get excited. But also I do a lot of health system strengthening work, and it's been very fulfilling in being able to look at large communities and populations and impact how healthcare is accessed. So if you really want to be a doctor or really want to go into a medical career, it is a fulfilling career with a lot of opportunities for you to choose from.
Hi, my name is Darnell Nell, and I'm a general surgeon with a special interest in education at the University of Cape Town. My advice to aspiring medical students would be make sure that you know the requirements to entry into the medical program. Make sure you tick those boxes. Of course, you need to work very, very hard at school so that your marks are very good. And then make sure you tick the other boxes like community service, etc. It's also really important that you know what you're in for. Medicine is an incredibly satisfying, wonderful career, but it is not as lucrative or glamorous as the TV shows make it out to be. It's a career of service, and it's important that you know that up front. So spend time speaking to doctors, do some job shadowing so you get an idea of what the profession is really about. Good luck.
Hi, I'm Limhang Malloy, and I am a general surgeon in acute care at Groote Schuur Hospital. So I was asked to give some advice or input about doing medicine. I'm in a couple of minds about it. So there's a couple of thoughts. So one, I think definitely do medicine if you think you like the profession. I must say, for me, when I came in, I didn't have much experience of what the hospital environment was like. So it was a bit of a shocker. But I must say, I've always thought I wanted to help people. So do medicine if you feel you want to help people, especially in the sort of health, healing space, wholesomeness, and you want to help people when they're most vulnerable. But with that said, if you have a brilliant mind, don't ask me what that means. But if you do, there's also the possibility of not doing medicine, all right? I think previously people used to think that smart people should do medicine. But actually, you do need the brains, but you learn a lot. And it's about learning and understanding and showing compassion. But I feel right now, with where the world is going, we need people who've got the brains. Not to say that, doctors don't have brains, but we need people who've got the brains to go into more problem solving, all right? So in terms of medicine, a lot of the things that are being practiced, how we care for patients, it has evolved. There's more technology, but the art of the practice is essentially the same. But we need more people to go into the space of developing all the things that are needed to aid healthcare. I don't know if that makes sense. So if you think you want to help in health, you don't necessarily have to do it by being a medical doctor. With that said, give it a try and you'll never know. Sometimes what happens is people do medicine and they actually realize, maybe I don't want to do clinical medicine. So it's good to have that exposure, and you can always branch out and do medicine in a different capacity.
Hello, my name is Amy Booth. I graduated as a medical doctor from the University of Cape Town. I worked for a few years and really enjoyed medicine, but decided that I would embark on a career in research. I now look at the environmental impact of health systems, and I'm based at the University of Oxford. And so I want to speak briefly about how you might think of a career outside of medicine. Medicine is fantastic. There's a lot that you can do with a medical degree. You can go into policy, into research, into economics, AI. You can join a tech startup. There's a lot that you can do. And so I would encourage you to just remain curious, think about what really makes you happy and the difference that you can make in the world. Maybe do an additional bridging course, enhance your education, speak to people in careers that you're interested in, and send those emails. Just take that bold step. It can be quite scary leaving medicine after you've spent so many years studying, but there's a lot of opportunities out there, so take them.